we're going to be going over the external bony features of the skull, or at least most of them. To start, we have the frontal bone, and right here, that's right about midpoint of the forehead, we have the glabella. Inferior to the glabella on either side, we have superciliary arches. Inferior to each superciliary arch, where our eyebrows sit, we have supraorbital foramen. On this model, they look more like notches, but they're typically foramen, and they transmit cranial nerve V1, which is the ophthalmic division of the trigeminal nerve, also known as the supraorbital nerve, and is sensory only. Just as we have a supraorbital foramen, we also have infraorbital foramen on either side, and those transmit cranial nerve V2, also known as the maxillary division of the trigeminal nerve, also known as the infraorbital nerve, which is also sensory only. The third and final division of the trigeminal nerve is known as the mandibular division of the trigeminal nerve, or cranial nerve V3. It has various different branches and is motor and sensory. One of its branches is the inferior alveolar nerve, which enters the mandible at the mandibular foramen and exits the mandible as the mental nerve at the mental foramen. We also have the mental protuberance of the mandible, the mandibular angle, the mandibular condyle, and the coronoid process of the mandible. The temporalis muscle attaches to the coronoid process of the mandible and therefore elevates and retracts the jaw. It's one of the four main muscles of mastication and the only one that retracts. To that same degree, the lateral pterygoid muscle attaches to the mandibular condyle and depresses and protrudes the mandible and is the only main muscle of mastication that depresses the mandible. The other two main muscles of mastication are the masseter and medial pterygoid muscles, which both elevate and protrude the jaw. Looking at the temporal bone, we have the squamous portion of the temporal bone. This is flat. Squamous means flat, and that's exactly what this is. We also have the mastoid process of the temporal bone, which is an important attachment site for splenius capitis, longissimus capitis, the posterior belly of the digastric muscle, and sternocleidomastoid muscles. Medial to that, we have the styloid process of the temporal bone, which is an attachment site for the styloglossus, stylopharyngeus, and stylohyoid muscles. Next, we have the zygoma, or the zygomatic bone. And we have the temporal process of the zygomatic bone, frontal process of the zygomatic bone, and maxillary process of the zygomatic bone. To the same degree, we have the zygomatic process of the maxillary bone, frontal bone, and temporal bones, respectively. Looking at the sutures, we have the coronal suture and sagittal suture. The junction between these is known as bregma, and if there was a suture here that separated the frontal bone into left and right halves, that would be known as a metopic suture. We also have the sagittal suture again with the lambdoid suture, and that junction is the lambda. We also have the occipital mastoid sutures on either side, the external occipital protuberance, superior nucleolines, inferior nucleolines, foramen magnum, and the occipital condyles.